From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse podcast. I'm Jason Tanoory, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Yo, welcome back. Dr. Jason here, Dental Lighthouse podcast. Super excited for my guest today. We shared some text messages about a week or two ago and some pain points that he was experiencing. And to be honest with you, it's pain points that we're all experiencing. I certainly have in my career, and I know that many of you have as well. So I thought there would be a ton of value with Mike coming on the show and unpacking some of his pain points and some of his questions, and him and I just having a great conversation trying to navigate some possible solutions. So without further ado, Dr. Mike from Ohio. Mike, how are you doing?
I'm doing well, Jason. Thanks for having me.
Well, I really appreciate you reaching out, and I appreciate you agreeing to come on the show and unpack this scenario that I'm excited to discuss with you. So let's add some context to your dilemma, your situation. If you could just unpack for our listeners in a minute or two, what exactly is the pain point that you're dealing with?
Okay. So I own a group practice, and I currently have 4 full-time associates, general dentists that are working for me. And I, in the last few years, am recognizing that we're lacking the advanced skill set amongst the associates. And I am questioning if the strategy is to recruit another associate that maybe has that skill set or is more interested in advancing their skill set, or if I need to double down on my leadership and motivation to get my existing doctors to want to do more in dentistry.
Awesome. Yeah, I really appreciate you on describing that. So just for clarity purposes, let's define some things here. When we say things like expanded skill set or unique skills or skills outside of general dentistry, are we talking about endo, wisdom teeth, all on X cases? Like, what specific clinical services are currently not being offered that you would like to see offered?
All of the above.
Okay. So your 4 associates are basically doing 2 surface fillings, single unit crowns, anterior endo, and calling it a day.
Yes.
Okay. And can you share with me and the listeners what you've tried to do up until this point to motivate them to expand their skill set or their clinical offerings to the patient base?
So I have tried to have conversations with some of them about what else do they want to do? Where do they have any interest or desire in additional training, which I would be happy to fund. And whether it's surgery, I mean, we've talked about sleep dentistry, TMD stuff, ortho, aligners, any number of things. And when we talk about it, they kind of hem and haw. Well, maybe I would do this or maybe I would do that. But I can't help but sense that they're just comfortable. They're paid reasonably well. And so to take on additional training, potentially additional stress, and probably not significantly move the needle on their quality of life, they just don't really jump at it.
Yeah.
I've tried to bring them into the treatment room with me doing, an implant procedure. Come check this out. This one's a slam dunk. It's super easy. Let me show you how easy this is. And don't you want to get on board with this?
Yeah.
And I'm just not getting the buy-in. On the flip side, I don't want to shove it down their throats. if this is not their happy place, I don't want to put so much pressure on them that I push people out.
Perfect. I love the additional context. So let me just give a little bit of my own lived experience before we continue the conversation. My mindset used to be that all I needed an associate doc to do was be a good core value fit, not hurt people, and do clinically acceptable dentistry. Like that was my barometer. That was my baseline. And in my head, it made a lot of sense to, as long as they check those boxes, to I was fine, right? And it sounds like that's kind of the situation that you're in with your four docs, right? Um, as I grew and as I started to struggle with the same questions that you're asking, I realized that there was a huge opportunity cost to continuing down the road that I'm at, right? So there's a huge need for, you name it, single tooth implants, wisdom teeth, adult aligner cases, all of these things. And the cost that you're having to incur by your associates not offering that, or having any of your associates offer that, is significant, right? Because they're either being referred out, so it's a lost revenue opportunity. It affects the customer service component because now you're not able to offer some of these services within your own four walls. It affects profitability. It affects just a litany of things. Would you agree with that?
Yes.
Yeah. So when I finally came to that realization, I had to change my mindset on what I would allow for an associate dentist. Now, I'm not suggesting that you just terminate these four people, but what I'm suggesting is I think you have to change your mindset on what either all or some of your associate dentists are going to ultimately provide for the group. And in my opinion, you have to get over the idea of what's currently going on is acceptable. Now, I'm not just saying that's right or wrong. I'm just saying, like, if you're going to try to move the needle here, if we're going to make a change, then I think it starts with your mindset and saying something has to change here. I'm not going to just sit back and instill this opportunity cost, or suffer this opportunity cost by just letting people just go through the status quo. Does that make sense?
Yes.
Okay. So if that's the mindset, then it comes down to, how do we move the needle? Assuming you love these four docs and assuming you feel like they all have the capacity to take on a little bit more, maybe one of them's aligners, maybe another one's wisdom teeth, maybe another one's, full mouth extractions, whatever it is. And I'll just kind of go through how I've had these conversations with my docs. One of the first ways that you can have these conversations is from a financial perspective, right? So during my one-on-ones, I'm bringing them data. This is what you're currently making. Is this something that you're comfortable with? Do you feel like do you want to have a conversation about how you can make more money, stuff like that? Now, what you'll find, and I'm sure you've experienced this already, is for some, that moves the needle, and for some, it doesn't. If you're having these conversations with people and they're not motivated by money, then it's going to be hard. But if they are interested in figuring out a way to either make more money in the same amount of time, or make the same amount of money in less time, then that opens up a door for you to have a conversation about increasing their clinical suite. And I don't know how old you are, Mike, but as I get older, the associates tend to get younger, and money is not the motivating factor. But what I have found can motivate them is to make the same amount of money in less time. So if we're going to talk about revenue per hour, which is what the conversation that we talk about in my world, if I can get an associate to go from, say, $300 an hour in revenue at 4 days a week to $600 an hour in revenue and now they can work 3 days a week, then that's very attractive to them. So that would be one of the angles that I would have with them about lifestyle. If they're interested in working less and making the same amount of money, then we're going to have to figure out a way to expand their skill set. Does that make sense?
Yeah, it does. I've never tried that approach. I mean, we've definitely had the money conversation, and they're not stupid people. They know if they're doing higher production, they're gonna end up making more money.
Yeah.
Uh, as I think I said earlier, I think that at least my team is they make a good income. They're comfortable, and I think you're also correct in that they're younger and not necessarily motivated by just the money.
Yeah.
But I've not approached it as a potential you match or exceed your production in less time, and I'll have you work less time.
Yeah. Yeah. So that's certainly one angle to tackle it from. Uh, Another angle that I've tackled it from is from a CE perspective. Now, again, I don't know what your internal system is, but we have mandatory CE requirements within the organization for the associates to maintain employment. Now, it's not hundreds of hours per year, but it's significantly more than what the state mandates. So, depending on how long you've been with the organization, it ramps up based on that. So, for example, in year one, it might be 20 hours of CE. In year 3 or 4, it might creep up to 50. Now, again, 50 hours of CE for someone like you or I that's been around the block is not a lot, but it's definitely more than most doctors, significantly more than what most doctors are doing. And if you mandate that CE, they're ultimately going to get put in front of situations where they're seeing what else is out there. So I'm not suggesting that you're not doing a good job talking about everything that's out there from their ability to increase their clinical suite. But it's kind of like parenting where, and I have 5 kids, I'm constantly telling my kids things to help them collapse time to get them further along. And more often than not, they're rolling in their eyes. They're like, whatever, dad. But my best friend or neighbor down the street could give them the same exact message and it finally lands and it finally resonates. And I have an 18-year-old son that's playing college football. We would have conversations all the time about how to get him stronger and faster. But whenever I would communicate that material to him, it would go in one ear and out the other. Now he'll have another person in his life give him the same exact information and it's really resonating and he's implementing it. So again, I'm not suggesting that your message is wrong. I'm suggesting that almost as a dad, these kids have heard you talk about this over and over again, where they almost kind of like block it out. But if they could get in front of someone else, some type of CE speaker, and you're at the size where, to be honest with you, you could bring in a CE speaker and speak to some of this stuff. I think it could really move the needle. Great example in my group. I have a doc that I love to death. He's been with me almost 10 years. And for the first 6 or 7 years, Jason, I'm a bread and butter doc. I'm not interested in anything else. I'm going to do fillings. I'm going to do crowns. Okay. I never really pushed him on it. He went to a clinical mastery course. Are you familiar with clinical mastery?
Yes.
Yeah. So he went to a clinical mastery course on treatment planning. It wasn't even a specific skill offering. It was treatment planning. And he left there blown away for 2 reasons. One, because he didn't realize how much more of an impact he could be having on his own patients by offering some of these adjunctive services. And 2, he surrounded himself at that course, that 3-day course, with a number of dentists that were younger than him that were doing some really cool things in the treatment room. And it just motivated him to kind of go to the next level. So the message here is like, yeah, you're beating the drum. You're doing everything that you think is right. But I think like parenting, you say something so many times, the kids just tend to block it out, where if they could get in front of another expert, another advocate, and they could hear it through a different lens and then be surrounded by other people, I think that could really move the needle. So that would be the second strategy that I would encourage you to consider.
Let me ask you this about the CE. Are you picking the courses that you want the associates to go to? Are you funding this? Are you funding travel? How invested are you getting in teeing up this CE?
Yeah, great question. We have CE allowances that ramp up every year based on tenure. Don't hold me to this, but I want to say that the first year is maybe 2 grand. The second year is 3 grand. And then it goes up to say 5 grand. And that 5 grand CE allowance is for the tuition and for the travel. So they will pay for it, and then they will ask for reimbursement, and they show receipts and what have you, and we'll reimburse them. So that's part of the answer to your question. The second part is who gets to choose it. I want them to bring me anything and everything, and then it's ultimately up to me. So 90% of the time, I'm saying yes. There have been some situations where I'll say no. So 2 examples of that is Botox. I've been burnt with associates going through Botox training, spending the $1,000 for the training, spending the $1,000, $2,000 for the actual materials, only to have it sit and expire on a shelf. And it seems like every 4 or 5 years, I'll have another associate ask for that. So I'm at the point now where I just say no, because it's been my own lived experience that it's a waste of money. Another example that came up a couple of years ago was forensic dentistry CE, right? It's cool. And if you want to take it on your own dime, please do. But you getting certified in some level of forensic dentistry does nothing to help me and what I'm trying to do in my organization. So I guess my point is, you want to say yes, and 80 to 90% of the time you're going to say yes, but it ultimately has to be your decision if you're paying for it. Along those lines, you could insist on one type of course that you guys either take together as a group, or you kind of do it in phases if you don't want to all leave the practice at the same time. So something like clinical mastery, a treatment planning course, something that's on occlusion or something like that, that's going to be all encompassing, I think could be a good idea to take 2 or 3 at a time. Does that answer your question?
Yes. Can I shift gears and ask you about so far the strategies that we've discussed are sort of external.
Yes.
Did you or do you focus on kind of your own internal clinical mentoring? Do you bring associates into the room with you and hands-on train, or do you mostly outsource their advanced training?
Yeah, great question. So I would rarely bring associates into my treatment room. Instead, I'm going into their treatment room. So let's use an example like you used before, like a single tooth implant, right? I would, during my monthly one-on-ones, or if they're a newer associate during weekly one-on-ones, we're doing treatment planning conversations. And I would say, this is a great opportunity for an extraction and immediate implant. And I know you have the skill set to manage this. So let's get it on the schedule. And then I will assist you throughout that whole process, because they do need a security blanket if it's new to them. So I've done hundreds of cases like that. Another great example is wisdom teeth, where someone will be treatment planning a wisdom tooth situation, and they'll be like, I'm going to send this to the oral surgeon. And I'll say to them, this is a very straightforward case, and I know you're scared because you've never seen it done. Let's set up a situation where we put it in your schedule. Now, I have the capacity for this. I'm assuming you do to a certain extent as well, where we'll put them in the schedule. I'll do the right side while they assist me, and then I'll jump over and they'll do the left side while I assist them. That's been a really good way for me to give doctors the confidence that they can manage these cases. And what happens only every single time, at least in my world, is you do this 5 or 6 times, you light a fire under them, and now they're ready to go out and get the CE that they really need to take this to a whole nother level, both in those 2 examples that I gave, wisdom teeth and implants, right? I can hold their hand through the first 3 or 4 implants or the first 3 or 4 wisdom tooth cases. And then they start to realize, okay, this is not as difficult as I thought it was going to be. I now realize I need to go out and get some additional training so I can own this and not have Jason here holding my hand in perpetuity. Does that make sense?
Yeah.
Yeah. The other thing I think we need to talk about is, again, going back to opportunity cost. If you go through these strategies and you find that it's not moving the needle at all, I would argue that you either need to, if you have the facility space and the demand, bring in another person, recruiting them a different way. We could talk about that in a second. Or looking at some of your lower producing, lower core value fit. Now, it sounds like everyone's great, but obviously some are better than others, and however you want to define that. Having some uncomfortable conversations, and then ultimately letting them go if they're not going to change who they are for the betterment of the practice.
Have you done that?
Oh yeah, 100%. Again, I used to have the mindset of be a good core value fit, don't hurt people, and I'll leave you alone. I don't care if you work with 1 assistant, 3 assistants, as long as you're producing like $2,000 a day and I'm not getting 1-star reviews about you, you're good. Like that was my barometer. That was my benchmark. And that served me well for 4 or 5 years. But then you start to get to a point where you're either running out of rooms, or you're running into the situation that you're running into, and you're like, I am sending out so much molar endo. I am sending out so much wisdom teeth. I am sending out so many implants. Like there's got to be a better way. And there is. The better way is you cut low hanging fruit. And I'm trying to say that in the most empathetic way possible. And you find an associate that has a specific skill set that complements the other docs in the practice. So when you're going through this interviewing and vetting process, you're looking for a surgical based associate, or maybe even looking for an oral surgeon. I mean, again, you're probably at the size where if you let 1 or 2 of this, let's say 1, I'm not trying to overhaul your entire practice, but you let 1 of these associates go and you bring in an oral surgeon 2 days a week. You bring in an endodontist 1 day a week, something along those lines. So you're able to check a lot of boxes. You're able to offer these patients the services they need in-house, and you're able to keep that productivity and ultimately that profitability within your 4 walls.
So that we didn't get a chance to talk about this beforehand, but that is actually the strategy that I have pursued for a number of years. I do have a part-time endodontist. I do have a part-time surgeon. We have an orthodontist. That was kind of my vision, was let the general dentist be general dentist and do the bread and butter, and then find the specialist to go do the specialty procedures. What I found is to keep a specialist busy full-time is difficult out of one practice. And to convince them to work part-time, you kind of have to overpay them. And you get to a place where it's not profitable, and maybe even a loss. It may be costing the practice money to treat that patient in office because we have to pay a specialist and motivate the specialist to come work with us part-time. Whereas some of these very simple endo cases could be done by the associates. They could be more productive, and maybe we don't have to pay them quite the percentage. It's still good for them. Yeah. But now it's actually profitable and viable for the business to provide that treatment in office versus the higher cost specialist.
Yeah, so a lot to unpack there. I would argue, without knowing your numbers, I would argue that profitability should not be dependent on part-time versus full-time. I have part-time oral surgeons. I have part-time pediatric dentists. I have part-time orthodontists. And it's structured in a way where we're making money based on how they get compensated and who we need to support them and stuff like that. And, we can certainly hop on another call and unpack the nuances of that. But it sounds to me like you almost kind of created, and I'm just saying this out of a position of love. It sounds to me like you've kind of created the situation that you're not happy with, right? Like if the mindset was, my general dentists are going to do general dentistry things and my specialists are going to do specialist things, then if I'm hearing you correctly, is the mindset that you were cultivating one where general dentists stay in your lane and do those things, and then specialists stay in your lane and do these things? You know what I'm
Yes, I will take full ownership of that.
saying? Perfect. So if that's not working for whatever reason, then I think you need to start to replace some of the general dentists, let's say one, with what I like to call unicorn general dentists, or people that have skill sets that are going to be a little bit more expansive. Now, I'm not talking about someone that does all on X cases all day long, or takes out full bonies all day long. But to your point, someone that can do molar endo, someone that can take out partial bonies, someone that can do full mouth extractions and deliver a denture, like these people exist. They're everywhere. I have 6 or 7 of them in my group.
And did you develop them or did you recruit them?
Both, both. So more of them were developed, but we're to the point now where I have multiple offices that have 2 docs, and I'm trying to be intentional about having the 2 docs have very different skill sets, very complementary skill sets. So if I have a doc in an office that is phenomenal at surgery, implants, then I want to bring in another doc that's more cosmetic, restorative based, and vice versa. So if we are looking for those types of docs, then it just comes down to how we recruit. Now, I recruit a number of different ways. I use headhunters. I use word of mouth. I use job descriptions and job ads that are specific to a specific skill set. So I call it an avatar, right? So you have to ultimately define what the ideal avatar is for you in a general dentist. And it sounds to me like it's someone that's surgery focused, someone that's endo focused, whatever it is. And you start to recruit and interview for that particular avatar, as opposed to what we were just talking about a few minutes ago. My avatar is someone that just doesn't hurt people, and can be competent, right? Again, it sounds like that's your current avatar. And again, no judgment, because that was my current avatar that was my avatar for a long time, until you start to realize the opportunity cost of having a bunch of those docs in your office.
Have you found that how many doctors do you have in any single location working together? So we have 4. Call me the 5th. All 5 working in one office. Do you have a situation similar to that?
Yeah, our flagship office is 22 ops, 6 docs, 5 general dentists, and we rotate an oral surgeon and orthodontist in there.
Okay, great. So, like in that example, do you find that having one advanced skill set doc gets along well with the group? Because part of this is I have looked to hire and bring on associates that, as you mentioned before, are just a good cultural fit that will get along well with the rest of the team. That was priority 1 for me. So I'm somewhat hesitant to recruit on skill set, and bring in kind of an outsider who says, I'm going to be a cowboy and do all the dentistry in here, and you guys are not keeping up pace, and just causing tension amongst the doctor team by purposely recruiting an advanced skilled dentist.
Love the perspective. I don't want to be misunderstood. For me, core value fit is always the number 1 requirement. So I'm not suggesting you go out and you find a cowboy that's going to disregard your value system, what you guys believe, your vision, but you're going to hire them because they can take out 4 partial bonies in an hour. I'm suggesting that they first and foremost have to be a core value fit. They first and foremost have to be a great fit. And then do they have the skill set that is going to be complementary? My most productive doc at my flagship office is a 40. If she's listening to this and I get it wrong, I'm going to get screwed. So I want to say she's 40. Um, she is the most humble, soft-spoken woman, but extremely good mentor to the other docs. And there's not an implant or sinus graft or wisdom tooth situation that she is afraid of. And now that came through her, allowing me to mentor her through very, very simple stuff 7, 8 years ago when we developed our relationship. And now her taking so much CE that I couldn't I couldn't hold a candle to what she's able to do now from a clinical skill set. All the implant pathway stuff, all she's taken a ton of just all of it, right? All of the guy down in Florida, oh gosh, Picos. So now she's the person, right? She does all of that major stuff. And she's now taking on my role of if one of the younger docs wants to start to learn how to do an internal sinus bump, and again, kind of coming full circle to the conversation I was having at the beginning, she's figured out a way to produce so much dentistry that she's now working 2.5, 3 days a week. And she loves coming in on an additional half day and holding hands of the younger docs. And it's like the circle of life, right? So that's now she's doing that. So, yeah, it's got to be a good core value fit. Otherwise, the wheels.
But you mentioned earlier that she is a unicorn, right? There are people out there with maybe good skill sets, but to be a good mentor, to be a good core value fit, to have that ambition and drive to enhance your skills like that, that is a unicorn.
Yes.
And, it sounds like in your case, you developed that unicorn.
Well, I cultivated it, right? So I pushed it. I gave her opportunity. But again, let's make sure we're talking about the same thing. What you're asking me for is how do I grab an associate that has this skill set? Like the mentorship and all that stuff can come with time if that's interesting to someone. If she was not a great mentor, if she's like, I really have no interest of going in the treatment room with some of these younger docs, Jason, and helping them, I would be like, okay, then I'll do it. But it's just watching her grow. And that's like the next part of it, right? Is like learning all of these things, realizing how much of an influence I can have on the patients and the business, and now trying to pass that wisdom and knowledge on to associate dentists that are 15, 20 years younger than me. I'm not suggesting that you have to find someone that's going to have that last part of it. The first thing you need to do, in my opinion, is find someone that's going to have the first part of it, which is basically a good core value fit that has an expanded skill set. And if you try to get your current associates to do that through what we talked about at the beginning of the call, talking about the money time balance, getting them in front of CE where they can get exposed to other people outside of your voice. If you've tried those things and it's kind of fallen on deaf ears, then from my perspective, you need to figure out, okay, who is the least core value fit here? Who's the least productive here? Who could we live without, so to speak, and replace them with someone that you intentionally are recruiting that has a complementary skill set to the other three that are left. I hope that makes sense.
Yeah, I'm following you.
Okay.
I want to ask you about another thing that's kind of unrelated, but also related. I believe you have some junior equity partners in some or all of your organization.
Yep.
These people that are calm partners, are they your high producers? And did the high production come before or after that relationship? Were you able to recruit some different mentality people by having that program, that opportunity that maybe brought you some opportunity to get engaged with some of these wider skill set associate dentists?
Great question. The answer is kind of all over the board. So we have, I think, 7, let's call them JV partners. They're all through the RSU model. And for the listeners out there that don't know what I'm talking about, go back and just listen to some of our older episodes. It's basically an earned equity model where the doc becomes a partner through their ability to generate dentistry, not through their ability to write a check to me. Is it the best system? Is it the perfect system? No. It's the right system for us and what we're trying to do from a scaling perspective. So I did a great interview with Perrin from Polaris, and we unpacked a lot of it there. So go back and listen to that episode. But to answer your question, most of the JV partners are high producers. Is it because of the model that we have, or is it because that's just who wants to be a partner? I think it's a little bit of both. Typically, these type A's, these driven people either want to be a partner in something or they're going to go start their own thing. And I didn't want to lose them to doing their own thing. That was the whole genesis of developing this model, associate retention and recruitment. We do use it as a recruitment tool when I'm talking to a prospective associate, and the question comes up as it does every single time. And you alluded to it earlier. Is there a possibility for partnership? My answer is always the same. Absolutely. There's going to be a 12-month dating period. And if you feel like it's a good fit for you, then we will offer you partnership. If they have any questions about partnership, I have 7 other docs that they can have a conversation with. Do they tend to produce more after they become partners? Yes, because the way that the model works is if they can produce, and I'm sure you understand based on how you asked the question, but for our listeners, the way the model works is you have a certain production hurdle. If you get to that hurdle and beyond, then everything beyond that, a percentage of that rolls into true equity that you've earned in the organization. So for us, based on what we're trying to do, it checks a lot of boxes.
Okay. So, but from your experience, you would say some of them were high producers regardless of the equity model, and some were motivated by the equity model.
Yeah, I definitely think it was a combination. So let's use, I don't have total context of your situation, but I've been on enough coaching calls to have somewhat of an idea. I would guess that if you offered partnership to any of those 4 docs, I'm making a gross assumption here, that none of them would be interested. Is that safe to say?
Probably, and that's my doing. I recruited them with no path to partnership. And I think in some ways, for some people, that's attractive. They don't want to be the heir apparent. They want to clock in, clock out, and not think of it outside of
right.
outside of these 4 walls.
Right. But one of my best friends, him and I like to have a few libations from time to time, and his daughters are now of the drinking age, and it's funny to hear him tell some stories about their drinking fiascos. And the running joke is plant corn, get corn, which is so true, right? So you've set up a situation where you're recruiting dentists that either are not interested in equity or partnership, or realize that they have no opportunity for that. And again, not right or wrong, but that's just the avatar that you've actively recruited. And it's been my experience that the highest producing docs, the ones that are driven, you, me, these are people that want to be partners in something, that something else is driving them. So is there a place for the $3,000 a day associate that has no interest in ownership? Absolutely. But it can't be every associate. Otherwise, in my opinion, you're going to run into the issues that generated the reason for us being on this call. Does that make sense?
Yes.
So
Yeah.
I'm not saying you change your partnership model. I'm just saying that it's much less likely to find someone that's driven to do the things that you're hoping your current associates or your next associate would do, because typically those people are so driven that they're going to be interested in in some type of junior versus, JV partnership, equal partnership, or they're going to do their own thing down the street.
And that's kind of the realization that I have come to sort of on my own. But I was interested in getting perspective from someone who had kind of gone through this.
Yeah, for sure.
I think that trying to force development among my existing team that I recruited under different circumstances might be barking up the wrong tree. And I may be needing to look for the new avatar, as you described.
Yeah. And the reality is, Mike, I think it's probably a combination of both. Like I referenced that one doc that's 40, was bread and butter, give me a filling, give me a crown doc. And then he went to clinical mastery and now he's lighting the world on fire. He's doing 2 or 3 aligner cases a month. He places 2 or 3 implants a month. And so it can happen. And he has no interest in partnership, right? So it can happen with that avatar. Like they change. It hasn't been commonplace for me, but I have a couple of those. More often than not, it's from a recruitment perspective where I can see a little bit of a glimmer and then you cultivate it through holding their hand in the treatment room. Next thing you know that they're taking, implant pathways and PICOs and all this other stuff. And now you've created an animal in a good way.
Yeah. Yeah. I think what kind of happened in my situation is you start with one associate and you're kind of doing the bread and butter dentistry, and then you grow some and you get to a place where it's too much for 2 people to handle that many hygienists. So you bring another one in, but you bring another one in that you think fits with the existing crew. And then you turn around and there's 5 of you, doing the same thing. And you just kind of think this is silly. Why are we not offering some other services here?
Yeah. Yeah, well, self-awareness is the number one thing, right? So the fact that and I'm sure you've been aware of it for some time, but I love the fact that you're fully aware of it. And I love the fact that you're going to try to develop some strategies to take your practice to a whole nother place. And once you do execute on this strategy, it'll just be a whole nother level of excitement, engagement, revenue, profitability within your 4 walls. I have no doubt.
Yeah, I'm interested in the dangling the carrot of more time off. I think that's an angle I've not tried.
Yeah.
But after this conversation, I'm probably more inclined to think that just need to find someone that wants to do that's going to be their career path versus trying to force it out of someone who's comfortable and signed on for a specific job, not for what I've evolved it to be.
No doubt. Well, again, I appreciate the call. I appreciate the question. I think this conversation will be just a ton of value to a lot of people that are in your situation, that was in my situation a few years ago, and people that will eventually be in this situation. So I appreciate the time, and don't ever hesitate to reach out if you have any additional questions or follow-up.
Yeah, I appreciate you taking the time to talk with me as well. This was valuable for me.
Awesome. Thank you, guys.
Thank you. That wraps up another episode of the Dental Lighthouse podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tanoory, your host. Thank you for listening to the Dental Lighthouse podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.